Alright guys, so this is the Mod 5 review, okay? I've gone over a lot of this in the videos and in class, so this is not going to be too big of a review. I'm going to draw some stuff off the test to kind of help you out, right? So when we're talking about unstable patients, what are we talking about? Are we talking about alert patients, people that are responsive to pain? What would be our most unstable of our patients? Somebody who's unresponsive, somebody who's responsive to pain, or somebody who's responsive to verbal stimuli. I'd probably say an unresponsive patient, right? So then what's next? If they have, let's say we have two unresponsive patients, one has a super high pulse, or let's say a pretty high pulse, not super high, pretty high pulse, and one has a low blood pressure. What would be more unstable? Somebody who is unresponsive with a pulse rate of 140, or someone who is unresponsive with low blood pressure? Probably go low blood pressure, because remember, compensating, our pulse rate's going to go up when we're compensating. When we're decompensating, our blood pressure is going to be down, okay? So that's probably what I would say. We talked about what causes heat cramps, but if you don't know, you should review that. What substance loss, when we lose a certain substance in our body, what causes heat cramps. If somebody has burns on their chest, what are we worried about? What kind of concern do we have if somebody has burns across their chest? So if I injure my shoulder, how are we going to treat that? What's the best way to treat shoulder injuries? That's something you should review if you don't know. I'm not telling you the answers on all these guys. I'm telling you things you need to review and look over. So just a disclaimer, if you clicked on this video and you thought Nick's going to tell us the answers to the test, and you've now gotten a minute in, realize that I'm giving you things that you need to look over and you need to know coming into my test. And hopefully you take the legwork to make that happen. So electrical burns. If I get shocked, where is that injury at? So if I grab something in my hand, is it an isolated injury to my hand, or could there be additional injuries? And if so, where would those be? Things to think about. When do we use a occlusive dressing? What's it for? Is it for any, any chest injury? If we have a closed chest injury, would you put an occlusive dressing on? Where would you put it on? Or does it have to be an open chest wound? And is it any open chest wound, or does it need to be doing something? Things to think about. Signs of brain injuries. We need to know what signs of brain injuries look like. If we have severe hypothermia, what's not going to be happening? So if we're to the point where we have severe hypothermia, what are we not going to be doing? Got to know how to calculate burn surface areas using your rule of nines and your rule of palms. Need to know those terms I put out in the email. That's going to be huge. Calculating GCS. If I give you an example of a patient who has his eyes open, can follow commands, but's confused, you should be able to figure that out. If I give you somebody who can't open their eyes and is confused, you need to be able to figure that out. You need to be able to give me those. So remember, right now I have a GCS of 15, okay? My eyes are open, I'm able to follow commands, I'm talking appropriately. I have a GCS of 15. This table I'm leaning against has a GCS of 3, okay? So a rock has a GCS of 3, an everyday person that's up and alert with their eyes open has a GCS of 15. I closed my eyes because I'm asleep, I went down to a GCS of 14. But you can wake me and talk to me pretty easily, right? When do you start to notice shock? Do you start to notice shock when I bleed a small puddle? Or would shock be more, how much blood do you need to lose for shock to kick in? That's my question. Is it a little bit? Is it a lot of bit? Figure that out. We know that. We know when to do that, so I'm not even going to worry about it. Some of these I'm going to just straight up, they're some of these questions, you're getting a reward for watching my video, or the videos. If you have a wound with a bite that is often painless, it's probably from a brown recluse. I didn't know that before I found this test, so why would you not? What are you going to do when you get to a chest wound? What's the first thing you should do on every chest wound? You can't even get to your occlusive dressing yet. What should you do first? Okay. You need to know the different types of injuries. That DCAP BTLS, you know what all those things are in DCAP BTLS. You need to know how to treat avulsions, how to treat amputations. You need to know the difference between heat exhaustion and heat cramps, okay? What about heat loss? Which two groups are mostly affected and why, okay? Kids have bigger body surface areas and they do their percentages. Elderly just have a hard time regulating body temperature. Know what the brain, which side of the brain controls what. So my right side of my brain controls my left side of my body. My left side of my brain controls my right side of my body, okay? What you put an occlusive dressing on, I know I mentioned this in the other ones, you need to know what to put an occlusive dressing on, right? How to put on occlusive dressing is important. How much blood loss is serious? How much blood can we lose before it's serious? Remember, your average adult, how many 2 liters? We talked about this in class. How many 2 liters they can hold? How much blood loss is serious? You know what posturing is. Should know what battle sign is. Okay, I may have led you wrong in one of the other videos. The CDC guideline that requires transport to a trauma center for a certain GCS score. Okay, if you have a GCS score with a 13 or less, you need to go to a trauma center. So progression of shock, okay, as it's getting worse, things that you're going to see first, okay, that you're going to notice as the care provider. You're going to see some altered mental status. You may see some pale and cool and clammy skin. You may notice some nausea, some vomiting. Their respirations are going to increase. Their pulse rate's going to increase. And then their blood pressure is going to drop, okay? So just remember, altered mental status is going to be first. You're going to start seeing some stuff on their skin. After the skin, they're going to get nauseous. Just think about kind of how you get sick, okay? With altered mental status being the first thing, you don't feel good. That's your altered mental status when you get sick. And after you don't feel good, you kind of get diaphoretic before you vomit, right? And then you start vomiting, okay? And then you start breathing heavier because you're vomiting. And your pulse rate goes up because you're breathing heavier and you just vomited. And then eventually at the very end, if you're really, really sick, your blood pressure is going to go to crap. It's the best way I can help you remember that. I think that's a pretty tough question, so there you go. If you don't have a tourniquet, what's something common that you can use to try to cut off blood on an ambulance? That's a common sense question. Should be able to figure that one out. Neurogenic shock. Know what neurogenic shock does to the body. What is happening to the vessels during neurogenic shock, okay? Know what JVD is and what JVD is a sign of. Once again, CDC question, a systolic blood pressure of less than 90 indicates the patient should be transported to a trauma center, less than 90. Remember that a flail chest is a very serious traumatic injury that requires immediate transport. Remember, that's a section of 2 or more ribs that will be moving separate from the rest of the chest wall. Those can often puncture lungs. That's why it's such a serious injury. They can cause severe internal bleeding. We want to try to stabilize those in place, and you should learn how to do that. You should look that up in your book on how to stabilize those in place. With that. A lot of situational stuff, what to do when. You're going to have to know that one. You know what cardiac tamponade is and commotio cordis. Okay, so the difference between ligaments and tendons, okay? I think of ligaments as bone to bone. Like my leg bone is connected to my leg bone through ligaments. And then I just remember tendons is the opposite, muscle to muscle, okay? So my leg bone, my bone is connected to my other leg bone through ligaments. That's the way I do it. You all are on your own if you don't like that. So if I asked you, you go into a motorcycle crash with a patient, what is the most important intervention to perform first? If your answers are things like put on a tourniquet to control massive bleeding, once again, I'm going to ask you, did the question say anything about your patient bleeding? Did it say anything about your patient bleeding? No, it did not. It said you had a motorcycle crash. So what are we going to do first on somebody that has had a traumatic injury? Okay? Don't let your answers, the potential answers, guide you into a path that you don't want to go down. Anytime we have burns, serious burns, what we should be focused on, what? What should we be focused on when we have serious burns? You guys got to know what decompression sickness is and pulmonary embolisms, all that good stuff. You need to know what arterial bleeding looks like. I think I told this story of we took a patient into Western Missouri once, and he had a head injury, but when we looked at it, it kind of just looked bloody and it clotted. We'd wrapped it real good with a pressure bandage, and the doc took off my bandage because that's what doctors like to do because they like to look at things. And as soon as they took off the bandage, I think they ripped our clot loose, and it started spurting. And it was shooting from trauma B, if you've been to the ER, all the way across onto the bed of trauma A, just like a fountain. It was probably the coolest thing ever. Know your vertebrae. So how many are cervical spine vertebrae do you know? Tina had a good thing, I think. She said something about, you eat breakfast in the morning, that's your cervical spine up top. And that's, you eat that around 7. And then you do something at 12, 5. I thought it was a pretty nifty thing. So hopefully you're paying attention to that. You need to know the difference between a subdural hematoma and an epidural hematoma, and a subdural contusion and an epidural contusion, right? You need to know the difference between strains, sprains, and fractures. Where we put heat packs to warm up a patient. Typically around the neck, kind of on the chest, armpits, and in the groin, okay? And you need to know what neurogenic shock is and what causes it, okay? Neurogenic shock and what causes it. Most of the time with neurogenic shock, we have some sort of spinal injury. It's going to be the original cause, and then after that, what it does. So know what happens when we do that. That is the Mod 5 review. I've sent out everything via email that you need to look over. I've given you some tips and tricks here. I gave you tips and tricks on a lot of the videos that you've watched before this, hopefully. And kudos to you for watching the video. If you didn't watch the video, they're going to miss out on a lot of this information because we're not doing a review before the test. This is a hard test, 100 questions, and I will not be here on Monday to give it. Remember, the test is Monday. Last thing, answer every freaking question, guys. You guys are not, people are leaving stuff blank, and it's killing you. At least guess. You got a 25% chance of guessing it right. Write down an answer for every question. All right. Good luck. We'll see you.